Good evening, everyone. Thank you very much for joining us tonight. We have an educational webinar tonight on COVID-19 and multiple myeloma, what you need to know. Before we start with the webinar, I'd like to let you know I'm Gabriele Colacerdo. I'm the Manager of Education and Patient Services on Myeloma Canada. I'll be giving you a bit of, I guess, the logistics of the webinar before we start. And so here we go. Apologies for this. It will start in a second. Okay. There we go. And so how do we, our educational webinars are all recorded. You can access them through YouTube and through our website on myeloma.ca. So either youtube.com or myeloma.ca. On YouTube, you go to youtube.com, you type in the address bar, Myeloma Canada, press search, and you'll get the first link that'll show up is Myeloma Canada. You can also subscribe to our channel here, and every time we upload a new video, you'll get a notification. That way you'll stay up to date to all the new things that we're putting on there. Next, from our website, myeloma.ca, if you click on the top tab here on resources, a menu will open up, and then you can just click on educational videos. That'll point you to our YouTube channel with all the videos. The next and last thing I wanted to cover is how do you ask questions during the webinar. So on your GoToWebinar software panel, you have a little tab here that says questions. If you click on the little triangle, it'll open up and you can type in your question right here. Once you type in your question, click on the button send. We will receive your questions and we will answer them. Obviously, depending on the amount of questions that come in, we might not get to your question, but we'll try to cover as many as we can. If you have other questions, please don't hesitate to call or email us. We're here to help. And so the other thing is that we're also going to have more than one question period during the session. So please, if you have questions, type them in as we go along, since there'll be 2-3 different question periods. So without further ado, we're very happy to have a special guest with us tonight, Dr. Brian Durie, a hematologist oncologist from Cedars-Sinai Outpatient Cancer Center, and he's also the chairman of the board for the International Myeloma Foundation in Los Angeles, California. Joining him is Dr. Hira Mian, who is a hematologist from the Juravinski Cancer Centre in Hamilton, Ontario, and also David McMullen, the interim chair of the Myeloma Canada Patient Advisory Council, co-chair of the Toronto and District Multiple Myeloma Support Group, and as well as patient representative for the Canadian Cancer Trials Group. So Dr. Durie, thanks so much for joining us.
Thank you for that wonderful introduction. It's really my great pleasure to be involved with this particular presentation today, which is so important for the myeloma community to understand the implications of this COVID-19 coronavirus infection and what are the implications for myeloma patients, their loved ones, and the whole range of people trying to care for patients with myeloma. So if we can move forward. So just to outline what the plan is for today. As you heard, the session will be divided up into 4 parts, and we'll try to make it about 15 minutes each. And then what would be helpful is if you have questions, to send in questions that relate to the segment that we're just covering at that moment. And so as you can see on the outline, which is slide number 10, we're going to start with what is this virus, the COVID-19, what are the symptoms and how is it transmitted, preventative measures and ways to avoid exposure to the virus, obviously one of the very, very key points. And then considerations for managing myeloma at this time when there is a risk of the COVID-19 infection, covering how should you manage your routine follow-up appointments, what about autologous stem cell transplantation, and then how do we handle treatments and supportive care. So if we move forward to slide number 11, if we can do that. So this is the spiky way that a COVID-19 virus looks. It actually has a special, like a little hook spike on part of the virus, which is the part which is really important because it's the part which is being used to hopefully develop a vaccine for this virus. So this COVID-19 is one of a family of human coronaviruses which have been circulating around the world. And fortunately, most of them don't cause severe illness or problems. However, there have been a number, and in recent years, there have been at least a couple that have caused very serious problems. And many of you may remember the SARS episode, which was really quite serious. And then there has been the Middle Eastern respiratory syndrome, which was actually a very, very dangerous virus, which caused a lot of problems, more prominently in the Middle East region. And so if we move forward to slide number 13, what are the symptoms that one needs to be alert about that could indicate the possibility of an infection with this COVID-19 coronavirus? Obviously, I think you're all aware this is a virus that started in China, and in this case, the origin of this virus was possibly that it was transmitted to humans, maybe from bats that live in a cave close to the original city in China. And what started to happen is that individuals there were starting to develop fever, which is the commonest symptom for this infection, dry, deep cough. So what this means, this is very different than bronchitis or a true upper respiratory infection. It's more of an inflammation that affects the lungs. And then just tiredness, just like the little dog there, just feeling not like doing much of anything. I would add that in addition to that, a lot of just general aches and pains affecting many different joints can be a characteristic feature. The typical symptoms of a cold or flu are not really what this is like. So it's not like where you have the sniffles, where you have a runny nose and some of the normal features of a cold or a flu. It really is characteristically different than that. And many times now the doctor can distinguish between that and what may be much more like this COVID-19. One of the very unusual things that has emerged in the last few weeks is that patients report that they have lost the sense of smell and taste. And this is a very prominent feature where they can't distinguish what they're drinking. They can't distinguish coffee from tea, from water or wine. It's a very dramatic thing. And in Korea, they looked at 2,000 patients who were affected, and 30% commented that they had lost their sense of smell. In a German analysis of 100 patients, they found that over 60% of the individuals mentioned this loss of smell or taste. So this is something to be alert about. As far as the time frame, it's important that it can take a few days for the virus to build up and for the infection to become obvious. And so this is really, really crucial for myeloma patients to be aware of. And this is one reason that it's tremendously important for myeloma patients to stay home. Because if you do venture out, even to the grocery store or other types of activities, there's no way that you can avoid possibly running into someone who does not know that they have the virus because they have just not started to develop symptoms, but they may in fact be spreading the virus. And so this is particularly important for older people who are particularly susceptible. And so if we move forward to slide number 15, how is this virus transmitted? Well, the key thing is that droplets of the infected virus go into the air when a person coughs or sneezes, and this is the main way that it can occur, either directly or from surfaces. And there has been a lot of discussion about how long can the droplets last in air. If someone has coughed or sneezed in a room, how long can the particles persist in the air? And the answer to that is that it can probably last for a few minutes. It's a little controversial. Some people say maybe 30 minutes. One other report said that it could be as long as 3 hours. But I think that this is probably not the main way that you could pick this up if you go to the grocery store. It's much more possible that you might have contact with droplets that have landed on hard surfaces. The droplets can persist on plastic or metal for quite a number of hours, even a day or two. And so this is the reason that we need to be so cautious about cleaning surfaces, wearing gloves, and the like. It's also important to be aware that some people will be negative and then can be retested and might become positive. So I think that this gives a general introduction to what is the virus and what we're facing, what the symptoms are, and how are the common ways that this infection can spread. So perhaps we could start with the questions. And so, Dr. Mian, perhaps you could start off, and do you have any things that you would like to comment about the virus and the transmission that you think is especially important?
I think just to reiterate some of the important points that you brought on about social distancing and how, it's really important for everybody right now to do that. But I think even more so important for patients with myeloma, regardless of really what state of therapy you're at, just to, again, because patients or individuals may be asymptomatic and you may not know about that. So social distancing and its important is just even more important for all myeloma patients.
Absolutely. And I can see, I'm looking at quite a lot of questions that are coming in now. And clearly, this idea of social distancing is very important. I don't know, Dr. Mian, if you'd like to comment on the use of masks. What is your? There are a couple of questions on that. What do you recommend related to masks?
Sure. For masks, I think right now, a lot of us throughout Canada feel that first and foremost, the masks, we need to ensure that healthcare providers have an adequate source of them. So right now, the only times patients maybe should be wearing masks is if they have symptoms and they're worried about transmitting it to someone else. But apart from that, just because with a limited supply of potentially personal protective gear as we go forward, we do want to limit the use of masks judiciously and see who is it that really needs it. So right now, we're not recommending it for everybody.
Absolutely. So I fully agree with that. I think we need to be more cautious about contacts, surfaces, and the like. One thing that does come up, and I see some questions related to this, is that within a family or a social group, if one person does test positive, then that person does have to self-isolate, and that would include everything, all kinds of contact, including, I can see here questions about food and utensils and different things. If someone has tested positive in the family, I mean, that is a concern, and that patient needs to stay in their room, and people who would go in and have contact with that person need to wear gloves and a mask in that setting. David, what is your perspective from a patient advocate standpoint?
Well, most myeloma patients, all the patients that I know, I believe are taking this very cautiously. From my own experience, my dear wife Erica does the shopping. She is extremely cautious about making any type of physical contact with anything in the grocery store. She does a dance around anybody else who's there. Occasionally, well, quite frequently actually, we go for a walk on our street. We don't go to, for example, the Niagara Escarpment anymore because there are too many other people with the same idea. That's near our house. Right. But whenever we come home, we take our shoes off, leave them outside. I try not to touch the soles of my shoes. I'll wash my hands right away, simply because there could be the virus on the sidewalk, on the streets. I did have to go to the cancer center after my healthcare team weighed the benefit and risks earlier this week for a treatment. And there, again, I was super cautious. I didn't touch any elevator buttons, danced around everybody. As soon as I came home, I took a shower, I put my clothes in the laundry, and again, left my shoes outside.
Well, I think that you're doing a fantastic job. Super precautious, but these days I don't think that being super precautious is a bad thing. But I think that you all on the phone and the webinar probably get the message that just hand washing when you come into contact with surfaces and just another way for the groceries is to have them delivered if you have that option, or this is a very good job for one of the younger family members to run out and do that shopping for you. And then when the groceries come home, just to be careful and maybe wipe them down before you put them away in the cupboard or in the refrigerator. Okay, so those are some of the main things. I'm trying to just touch on some points that have been raised in a fairly large number of questions. I think that if you have some of these gloves to wear, that is a good idea when you go out and about, and then just be very careful to remove those when you get home. All right, so let's move forward a little bit into some of the other issues. Preventive measures, what we've been talking about is social distancing. And so this is a new phrase, a new buzz phrase that we're all getting used to. And I do think it is incredibly important right now to reduce the spreading of this dangerous virus, that if you can stay home, you certainly should stay home. And I strongly, strongly recommend this for all myeloma patients, aside from urgent clinic visits where they have to go in and get a treatment that they absolutely need. And to really, as you were hearing from David, be most cautious, avoid close contact with others. And this limit of 6 feet or 2 meters, that is related to if someone coughs or sneezes. As you can imagine, the droplets will fall down onto surfaces, and so it's just to avoid direct contact through those droplets. If we move forward to slide number 18, so a key point, which cannot be emphasized too strongly, is that if you have come in contact with a surface or something that you think could be a risk, do not touch around your eyes, nose, or mouth area until you've washed your hands. And so, as you just heard David describing, when you come back in the house, wash your hands right away. And then use this technique, wash your hands, soap and water, or antiseptic if you happen to be lucky enough to have a lot of that around. And then this idea where you sing happy birthday twice, at least 20 seconds, and don't forget the backs, between the fingers, under the nails, just really do a good job. And I think that doorknobs and other surfaces are important to pay attention to. And then if we move forward to slide number 19, you see in these different press conferences that people do need instructions with this. Cough into your tissues or into your elbow not towards any of your friends. Throw away tissues right away. Obviously, don't share personal items, and really try to keep things that you're using a lot, like telephones and iPad screens, keep those nicely cleaned down periodically during the day. And as we've been discussing, you do need to stay in close contact with your doctor, but you should do this by telemedicine, by telephone, by email, and really cut down on the visits to the clinic, and really avoid going to the hospital at all unless you really do need to have some kind of urgent care. And if we can move to slide number 20, we were just touching on the use of masks. The key point about masks is that the mask is largely to prevent you from spreading infection to someone else. It does provide some protection to you, but it's more important to spread it, to stop spreading it to someone else. And as you heard, there is a drastic shortage of masks, and so if for someone who's not infected and is not in close contact with other people, we're not recommending routinely using the masks. The N95 masks are the ones that are in really short supply, and those are drastically needed for our doctors and nurses and other healthcare providers. And if you are using a mask, obviously you need to wash your hands before you put it on, and you need to be careful how you take it off, and you should not reuse masks. And the fact that some doctors are saying that they have to is really quite distressing for me, frankly. If we move forward. So obviously if you got your gloves on, don't touch your face, and just work carefully to roll down the gloves as you take them off from your hands. Dispose of them, just open the bin with your foot pedal, hopefully, and then wash your hands, and don't reuse the gloves. And if we move forward, right, so we've gone a little bit more deeply into some of these issues. Are there any other of those more detailed issues that you'd like to emphasize, Dr. Mian? Maybe especially related to patients coming into the clinic or not coming into the clinic. How are you handling this right now?
Yeah. No, thank you for bringing up that point. Right now, it's a chaotic time for all of us, and we're trying to, as healthcare providers, manage a lot of different things. So I think at this time, we really are looking for patients to ask us questions, to say, do I really need to come in? If you're coming in and you're not quite sure if you really need to come in, I think it's perfectly fine right now to give us a call and say, I'm supposed to come in for this bone building medication. Does it make sense, or can I delay it? So just giving us a call, and we're really there for you at this time, but just engaging in that open communication with us at this time is quite helpful. And then I think if you are having symptoms, if you are having a fever or a cough, or you've been in contact with someone who has those symptoms or has tested positive for COVID, it's really important for you, if you're scheduled for an appointment, to actually give us a call beforehand to tell us about this, so then we can give you guidance around not to come, how to reschedule the appointment. But I think sometimes you might be stuck at the door, asking us these questions, whereas if we had a little bit more time ahead, then we can appropriately triage it. So just lots of communication during this chaotic time will make sure that both we stay on track and the patients also stay on track.
Yeah, Dr. Mian, that idea of calling ahead to prepare so that you're not showing up unannounced. Yeah, so sorry, David, please go ahead.
Okay, thank you. Just to add to your comments, from my personal observation and from what I've heard from the Patient Advisory Council, I'm really amazed at how quickly the cancer centers in Canada have adopted to the pandemic in changing their protocols. Kudos to them, but it's still, as you mentioned, it's still work in progress. So as you've suggested, Dr. Mian, I would suggest as well, patients shouldn't be shy about initiating the conversation with their healthcare team regarding things like upcoming appointments and treatments, just to help in that regard.
Absolutely, and we're going to get into this maybe a little bit more, but maybe do you want to start the conversation, Dr. Mian, about autologous stem cell transplant? A number of questions have already been coming in about that. People are concerned. Number one, if one has been scheduled, should they perhaps delay it? And then also, if someone has actually gone through a transplant in recent weeks, special precautions in that situation. Perhaps some comments about that.
Sure. So I'll start off by saying this is a rapidly evolving field. You know, the information coming to us day by day is different. And this will also depend upon where you live across Canada. So, you know, whether you're in Toronto versus a smaller city. So some of these factors will be dependent upon what's locally happening. Probably the best person really to ask this question is going to be your own physician, who's going to be able to really weigh the risks and benefits. In general terms, you know, we are trying to delay a lot of autologous stem cell transplants for a number of different reasons, because patients become quite immunosuppressed during that time, and with the uncertainty around COVID, we don't want that to happen. And also, we're not really sure what will be required from our healthcare resources in the next few weeks as well. So that's another reason to at least think about potentially delaying it. So I think it's a really great conversation to have with your doctor. If you are being scheduled for a transplant in the upcoming few weeks, you know, perhaps the cells can still be collected, but the transplant can be delayed. But there are some conversations that you should have individually with your physicians, and really things are changing day by day, week by week. So what we're doing today may not be what we're doing by Monday. So it is a rapidly evolving field. For the second part, for patients who've just recently had their transplant, again, you know, we've emphasized the social distancing and good hand washing, but really we're trying to minimize their risk of getting any infection, because even if their white blood cell count is normal, they're still at high risk for infection. So in those cases, you know, if for some reason you're scheduled for just a regular blood count at the hospital, that's a good time to call in and say, well, you know, can I get that done at an outside lab? Do I really need to come into the hospital? Can someone come in and do that blood work for me? So just, again, asking a lot of questions around that, because, again, those are two vulnerable populations we really that want to protect.
Absolutely, absolutely. Those are really key points, and I can see other questions coming in. We're going to go through some other aspects of treatment and modifications that could be used, and so we'll do that as we go through the next segment. Maybe one question I can just handle as it's come in. It's helpful at this moment is to be aware how many myeloma patients have in fact been affected by the COVID-19 so far? And the answer to this question is remarkably few. So this is actually quite a positive message. As I understand it, there's only one patient that's been affected in Sherbrooke Hospital outside of Montreal in Canada. And in the US, we only have 2 patients thus far that have been affected with the COVID-19. And the numbers are a little bit higher in Italy, France, and Spain, but the numbers are still relatively small. What I'm talking about is maybe 3-4 patients possibly in each country. And one very, very remarkable thing is that throughout Asia, where this whole pandemic began, actually no patients died with myeloma in China or Japan or Korea or all these Asian countries, where actually they're very, very cautious about infections and have really done an amazing job protecting the myeloma patients. And so with good precautions, I actually have a feeling of optimism that myeloma patients can be protected following some of these guidelines that we're talking about here today. So if we go forward into this next segment, we touch on a few other more detailed aspects. If we can go to slide 23. Yeah, so am I at risk? Well, I think that this is a key point that obviously even patients who are out from having received transplant are in remission, there still is some reduced immunity, and if you are on a maintenance therapy, there could be some reduced immunity. As we'll get into in a minute, the balance is that ongoing treatment more important to keep you in remission versus cutting back to maybe reduce the risk of infection. For dexamethasone, there's a question I see popped up there. There are definitely options to reduce the dose of dexamethasone, which has actually been recommended in France and the European countries as one helpful thing that can be done. But as far as people being at risk, I would draw attention to the fact that myeloma patients who actually have other medical issues are at more risk, because these are the things that seem to be particularly important. Age is important. Unfortunately, individuals in their 70s or in their 80s are definitely at risk. If you have myeloma, a type of cancer, you're at risk. But patients with underlying lung respiratory illnesses are definitely at risk. There is a strange correlation for patients who have high blood pressure. A particular receptor called APO number 2, the receptor that's used in the treatment of high blood pressure. Patients with high blood pressure are actually at increased risk of COVID-19 infection, as are patients with diabetes for a similar reason. These are key things. If you're otherwise in good health, this will definitely be important at this crucial time. If we can go to slide 24. We've just been touching on these points. Absolutely check in with the doctor, speak to your healthcare team, as it says at the bottom of this slide. Schedule appointments only if they're absolutely necessary. I think it's reasonable to think about delaying the bone protectors, the bisphosphonates. Absolutely think about delaying an autologous stem cell transplant. And I'll be interested in the thoughts of Dr. Mian and David related to the pros and cons of the immunomodulatory drugs, the lenalidomide and the pomalidomide. Also not on this slide are the proteasome inhibitors, and then of course the monoclonal antibodies, dexamethasone and the like. And so I think that as we move forward, we can perhaps touch on pros and cons of continuing some of those drugs or looking to reduce or stop some of them. On balance, it is incredibly important to make sure that your myeloma is, in fact, staying in remission. Next slide, slide 25. Yeah, so I think that there are quite a lot of questions that have been coming up related to the ongoing treatments. And so maybe you could start, Dr. Mian, and talk about are there ways that you're looking at treatment regimens and making adjustments, maybe to switch from an IV to an oral, or reducing dosages, or what modifications in patients' treatment regimens are you looking at these days?
I know, perfect. And again, as you had mentioned, a lot of this will depend upon individual circumstances and on your specific case. But, you know, the bone building medication is one easy one where we're delaying it and have, for the most part, actually canceled it at our institution for the next upcoming few months. Another, you know, if you're on treatment and you've been on it for a while and you're otherwise stable, we also don't want to make a lot of changes, because during this already chaotic and unpredictable time, we need your myeloma to be in fantastic control. And so if you've been on something like lenalidomide maintenance and your blood counts are fine, then I'm tending to leave things the way they are. But I'm still making some modifications. So for example, at our site, lenalidomide is dispensed through our pharmacy. So what we've been able to do is with our pharmacy, we can actually ship the lenalidomide to your house. So I will, at my particular institution, I will get blood work done at an outside lab. I'll look over the blood work, we'll do a telephone visit, I'll check in with you, but then instead of you coming into the hospital, we can probably just send it to you at your house. So some small modifications like that are quite helpful. With regards to IV therapy, especially something like daratumumab, which is already associated with respiratory concerns, we're really trying to weigh the risks and benefits in terms of myeloma control and whether we can potentially delay it. And minimize some of the hospital visits. So sometimes that may mean we end up either stopping a drug like Velcade for a short while or substituting in an oral drug in its place, something like ixazomib, which is an oral proteasome inhibitor. So again, the situation's constantly changing and we're making adjustments and really trying our best to make sure that the myeloma stays in control and we minimize any chances of infection.
Very, very
and then
good
the
comment.
dexamethasone, sorry to mention, is one easy one where we're just going down on the doses for a lot of patients.
Exactly, because the dexamethasone has two types of risk. One is that it can mask an infection, so you might not know that you have a fever, and then also it does increase the risk of infection. And I especially liked your idea of maybe shifting from an IV or a shot of Velcade or Kyprolis and looking at oral ixazomib as a proteasome inhibitor. This could be a helpful shift at this time, and as I understand it, this has become an access option in Canada, which is great.
Thank you both.
So, David, please. How does this sound from the patient perspective? Yes.
It's reassuring, and thank you both doctors. That question about should I carry on with my treatments is something that is in the minds of many patients, particularly regarding the concern, is this going to increase the infection risk? But the way you described it there is, calmly, weighing the risk and the benefits and, being very mindful of keeping the myeloma under control. I appreciate the way you've done that. I think many patients in the call will appreciate that as well. So thank you.
Okay, very good. There is a question that popped up. Maybe I can just answer it now. There was a question about when I say risk, am I talking about risk of getting the infection or risks of having serious problems if you have the infection? And this is actually a very astute question because actually we don't really know if myeloma patients are more likely to kind of pick up the infection versus an average person. In fact, the data from China would suggest that maybe myeloma patients are not particularly extra predisposed to pick up the infection or to become infected, so to speak. The concern is that if you do have these risk factors like older age, high blood pressure, diabetes, if you happen to have been a smoker, if you happen to have been a man, these are risk factors for developing more serious complications. And so that's what the risk is referring to in this situation. You're talking about what is your risk of becoming rather ill if you happen to get infected. And so the key point that I emphasize constantly is that for myeloma patients, you just want to work as hard as possible to avoid exposure. You just do not want to catch this infection at this time, if at all possible.
Dr. Durie, maybe that's one. I'm just going to say,
yes,
maybe that's
please.
one reason why the rates of the COVID infection in Asia and elsewhere for myeloma patients is not higher than it is because we do more than the average general public try to prevent getting the virus.
Absolutely. And actually, this was mentioned to me by a number of our experts in Asia that we've actually published very, very detailed guidelines for myeloma in Asia. And interestingly enough, the guidelines vary in different parts of the world. But in Asia, they strongly emphasize, and this was, years ago, we published this back in 2003, they strongly emphasize that myeloma patients need to guard against infection, and I think that there has been a natural tendency to do that, and this has been very, very helpful in this current crisis scenario. So, all right, well, let's move forward into the next segment here, where we talk a little bit more details about if there would happen to be a COVID-19 infection, what can we do and what can we look to the future about? So first of all, there are obviously supportive things, and this is what you are hearing about constantly on the news right now. With the lung problems, you need oxygen, you need respirators, unfortunately. So all these very, very detailed supportive care measures are actually crucial and life-saving. For now, it would be great if you could go out and get vaccinated so you would not develop this infection. I think the reality is, despite all of the rhetoric that you hear on the news, is that it's just going to take quite some time to develop a vaccine for this virus. I think that you've heard Dr. Fauci say that it'll take a year to 18 months. I think it will take at least a year. There are a number of new companies jumping into this with new technologies where they're saying that maybe working more aggressively, they might have a vaccine within 6 months to a year possibly. But the bottom line is that this can be important for 2021 and maybe for the future, but for right now, that's not going to be a key thing. And so it will be a way of prevention for the future. If we can move forward to the next slide. Oh no, let's go back for a moment. To the previous slide. I'm so sorry. Yeah. So I think that the one thing that I didn't mention are the therapies that are available right now to treat patients with COVID-19 infection. And so the one that you've heard about on the news is chloroquine and hydrochloroquine, and there are some data from China and elsewhere indicating that this can be effective, but we need to be extraordinarily cautious. And what are going on right now are several randomized controlled clinical trials to see if chloroquine either alone or combined with an antiviral agent from the company Gilead can actually shut down the virus infection. And there have been some promising reports, but I mean, you really need to look carefully in a randomized fashion to know that any of these therapies can work. One other very, very positive thing to be aware of is that in the very catastrophic situations where the sick patients develop like a shock syndrome where the system seems to shut down, it does turn out that this is very, very similar to the cytokine release syndrome, which occurs with CAR T-cell therapy. And as you are probably aware, we do have some treatments for that, including we use steroids in that extreme situation, and we also use an anti-IL-6 medication, which is used to treat the CRS syndrome. And patients have actually recovered using this technique. And so there are some promising things to help patients get through the roughest periods of infection, and hopefully we'll see patients who are coming through and surviving despite getting incredibly ill. And so, Dr. Mian, maybe you can comment on your perspective on the vaccine, and then also perspective on these different aspects of treatment. What's your perspective?
So, I mean, I think I share the same sentiments with you about the vaccine, that I think that although we would like it to be developed really quickly, I think it will take some time. It's also difficult to know how the virus may mutate, and so there'll be additional challenges that will be required to really have a good vaccine. Right
Right.
now, with regards to treatment, so there are some randomized studies that will be happening in the United States and even in Canada. There's a huge push to start a randomized control trial looking at chloroquine with azithromycin um,
Yes.
out of McMaster University. And I think the plan is for that trial to be up and running really in the next 4 weeks. So that will be, again, another huge Canadian effort to try to see if we can combat this and have a clinical trial within Canada as well. And then the last drug that you mentioned, tocilizumab, is an interesting one because really throughout Canada right now, not a lot of hospitals have access to it. So there's already been some conversation about ensuring that different institutions have access to it and how to make sure that there's enough of a supply for it. The only other part, and maybe Dr. Durie, it would be good to get your thoughts about this as well, were about NSAIDs and patients self-treating
Yes.
themselves with NSAIDs, because that's been
Right.
one of the
There's
recommendations.
there's a question popped up about that. Yes.
Perfect.
So do you want to comment on that? Yeah, please go ahead.
So, I mean, it just, there seems to be increased morbidity and mortality in patients that have COVID and that take these non-steroidal anti-inflammatories. Now, a lot of myeloma
Right.
patients don't take those anyways because they're on chemo and they've been told not to. It's hard to know if those patients that were taking those NSAIDs and had COVID, they were self-treating it, and so they had a higher risk of infection. But right now, generally, the idea is that you probably shouldn't be self-medicating with something like NSAIDs for treatment or prevention of COVID.
Exactly. And so maybe something like Tylenol would be preferable to Advil, for example, which is one of the questions here. Right.
Yeah, exactly. And I mean, it's similarly, I mean, even in the US, there's case reports of patients now taking chloroquine or azithromycin on their own. Again, until a lot of this data is shown in a randomized control trial, you really need to be in touch with your healthcare provider prior to taking anything.
Right, right. Another question is the vaccine likely to be one that myeloma patients can take? And I think the answer to that is yes. It will be a dead vaccine, and so it's not going to be one of those where it's a live vaccine that would be a concern for myeloma patients. Although, kind of like for the flu vaccine, it may be that we recommend like a double dosage or something to make sure that a myeloma patient is actually immunized. So there could be some different recommendations, but should be safe for myeloma patients to take, I believe. Any comments about different approaches to treatment, David? Obviously, it's reassuring that we have some things that we can do to help.
Absolutely. Well, patients are looking forward to the results of the research and the trial that you mentioned, Dr. Mian, in 4 weeks. That is a very fast schedule, so we're very encouraged by that. But certainly, we're looking to any future information, advice from your research or from your clinic observations, you and others in the medical community that could be used to help treat the disease. Thank you.
Right, right. So another question that's popped up, and I don't know if you are expecting anything like this in Canada, are we expecting shortages of medications? Are we expecting that maybe because of the supply chains being disrupted that we might run out of some of these medications like Revlimid or some of the drugs that we're using? Do you have any thoughts about that?
Certainly something that's high up on the priority list and something that we're thinking about. So far, there's no indication of that we're going to run out of any essential chemotherapy medications required for myeloma. And I know that at a national level, there's already been efforts, and we've already been in touch with a lot of pharmaceutical companies to ensure that that does not happen. There's other drugs like the tocilizumab, which is that IL-6 inhibitor, which is already not available everywhere else, and it's hard to know what that supply will look like. But for the most part, I think right now in Canada we're in pretty good shape.
Right, and I think that's going to be the case. And my sense is that the pharma companies as a group have been incredibly alarmed and actually supportive of all of these different things that we are looking to do. For example, another question that we didn't touch on that maybe you could comment on is clinical trials, access to clinical trials, and then modifications of clinical trials just because of these logistics and practical issues that we face. The FDA has given some new guidelines, and the pharma have, for trial by trial, have been telling me that they're willing to make changes. Has this been your experience in Canada?
Yes, similarly, and it's very trial specific. Certainly, a lot of new clinical trials have been delayed, which is a little bit unfortunate because some of those therapies would have been quite needed at certain times for patients. And some of the other trials now have some slightly modified schedules. So instead of, you can do a phone visit, or there may be some modifications to schedules, but certainly it's an evolving target and it's rapidly changing.
Right, right. And what we've been doing in the States, and I think you probably will be able to do it more in Canada as well, is if you have a patient that was going to go into perhaps a CAR T trial or one of these trials which are just not going to be feasible right at the minute, you need to look at what would be some options using combinations of approved drugs, or recently approved drugs, or, perhaps combinations that are not typically used. And so we've been looking at these kinds of combinations for those patients who do need some new therapy for relapsing disease. I don't know if you've been faced with that.
Yes, I mean, our drug access in Canada is a little bit more strict, but even then, we've already been in touch with a lot of agencies, like Cancer Care Ontario, to try to see if they would be a little bit more flexible in some of their regimens and allow us to do that. But I think, like you said, hopefully this will come to an end, and hopefully that will be in the near future. So to think of some form of bridging therapy, whatever our existing local sources will allow us to do that from a funding perspective, just to, keep your myeloma under somewhat stable control till we can get to that definitive clinical trial is the goal.
Right, right. And I think that is a key point that you touched on there. And I've used that and actually in my blog last week, I showed a picture of a double rainbow. And I think that this notion that there is light at the end of this, that as best we can tell, this is very serious right now, but I strongly believe it will run its course over a span of, I think, probably more like a couple of months. In April and May, I think we will be challenged. But I think that it's very reasonable to be thinking that by the middle of the year, we will be able to get back to using some of these things, or maybe starting patients on treatment that maybe it would be really good if they could have access to. And so I think it is important to look at this as a limited, very challenging crisis, but one that we will indeed get through. And so, David, I don't know how you look at this from a patient perspective.
Well, that's very encouraging. Your thoughts of how given mid-year things are going to come back to normal.
Well, maybe you normal, but where we might be able to do some of these things that we can't do right at the minute.
Right, right. One thing that you've talked about in your blogs a lot is resilience.
Yes.
And the whole aspect of mental health.
Yes.
is extremely important, and we as patients kind of have been hit with a triple whammy. We've got the challenges of dealing with myeloma, plus we have the pandemic challenges that everyone has, and plus possibly a greater susceptibility to the COVID. And particularly, as you mentioned, the challenging time over the next 2 or 3 months, where we're all housebound. Anything we can do. I saw in your blog you had a nice picture and description of 2 hummingbirds outside your kitchen window. This was something you marveled and you appreciated. So things like that will brighten our days. Just a brief suggestion, kindness, being kind to people that you communicate with, especially as patients or caregivers. It makes them feel better, and likewise, it makes you feel better. Kindness is truly empowering, especially now.
Absolutely, and kindness to all of the healthcare providers who are really, as you can tell from what we've been discussing, really committed to make the environment as safe and nourishing for myeloma patients, so that we can all get through this together. So if we can go forward on these slides, I think that we are moving towards the witching hour here. There are a lot of other considerations. Obviously, we're very concerned about family and friends and our contacts, and it is important to have a clear action plan of who are you going to call if symptoms emerge. It's not Ghostbusters. It's any one of these numbers that are listed here on slide number 27. And I think that finally, paying close attention to mental health and resilience. An important aspect of resilience is the capacity to adapt to challenges. And so this is kind of like taking a deep breath and just thinking and seeing what it is, what new things, what little bits of changes can help us to move forward with strength and a positive attitude, and as was emphasized by David, kindness to others through all of this. We're all in it together, and we want to get through it safely and strongly and with resilience. So thanks to you all for your active involvement with this session and sending in your questions. We haven't covered all of them, but I've tried a lot to cover them. Just one final one, the sub-Q daratumumab is not going to be available till later in the year. I'll mention that, either in the US or Canada. So that's a little bit unfortunate. We don't have that access yet. There are links for public health agencies in Canada and the World Health Organization. All of those have tremendous information. And to the next slide. Conclusions, yes. So watch out for the most common symptoms. Definitely practice social distancing. Stay home. Avoid touching your eyes, nose, or mouth. Wash your hands until the skin is running red. Yes, wash your hands a lot. And speak to your healthcare team and organize your planning and avoid unnecessary visits to the clinic and hospitals.
Dr. Durie, may I make a brief comment about social distancing? I've heard the term physical distancing being used more now. The socializing is critically important. We just have to do that, not in person. But part of the mental health, socializing with our family and friends using telephone and electronic means, that's important. It's the physical distancing that we need to be particularly prudent about.
I really appreciate that distinction. That is a very, very key point. It's this physical distancing that is to make a difference, but this socializing electronically and by all other means is actually tremendously important right now, so that we can stay together, work together, and move forward together. Yes. And next slide. I think that we have reached the witching hour for this session, and I'm going to turn it back to Martine Elias from Myeloma Canada, who will have some closing comments and words of wisdom, I'm sure. So thank you so much, Martine and your team, for this opportunity to participate with Myeloma Canada.
Well, thank you very much, Dr. Durie. The thanks goes to you and to Dr. G.M and to David McMullen for graciously participating in tonight's webinar. And I also want to thank Gabe for arranging this webinar, because without him, this would not be possible. I know we are a small and mighty team, and you can see the pictures of everybody here, and you see at the bottom corner where our office is. And today we're not working from our offices. We're actually sort of all working from home, because we do take very seriously the concerns that our community have with respect to this coronavirus. And we've, like many other organizations in Canada, have canceled all of our face-to-face education programs and all of our different points of contacts, because we know that it's really important to keep our community and, my staff safe. But to the point that David and Dr. Durie made, is the importance of keeping in touch is more important now than ever. And this is why we're going to be moving forward with providing different types of touch points that we would usually normally not to do. So looking at virtual education programs, some things that we're happening that we're doing tonight is an example of how we will provide and continue to ensure that you're kept informed with all of the cutting edge information with respect to COVID-19 and how it affects myeloma. So we're going to be doing more of these educational webinars, and we certainly invite you to follow us on our website and on Facebook and through our email, so that you can be made aware of when these will be held. I mean, we're working on a schedule right now, and as you can imagine, trying to get physicians is also very difficult, because they're working really diligently in ensuring that their clinic and their hospitals are ready and that they can keep you safe. We are going to be issuing a weekly info bulletin on COVID-19. And again, we are going to curate the information that's going to be important for you from a myeloma perspective. I don't know if you're like me, but I get about 20 or 30 different emails about COVID-19 on a daily basis, and they're coming from companies that I haven't done business with in over 10 years, and I wonder, how did they get my emails? So we want to make sure that the information that we provide to you is relevant to you. And so we will make sure that in our bulletin, we focus on that particular information. And obviously the Dr. Durie blog is definitely very high in our list, because the information that he provides is actually really tremendously important for us. So finally, we're going to looking at the facts. We're looking obviously at our marches, and I know the marches season is in September, October for Myeloma Canada, and we know this is an important time for a community to get together and meet with friends and work for supporting our cause. So at this point, we are going to do a soft launch for the marches, because they do take a while to organize, but we are very conscious of the social distancing, and so we'll be looking at different ways as well to provide you with opportunities to do perhaps virtual marches where you can get together. It's very stressing. I know, I feel it when I talk to people every day, and we know you have a lot of questions, and we need to get access to resources online in your community. If you need some help, please contact us. If you need someone or to find out how you can get groceries or how you can get medication delivered to you, we're more than happy to help you to do that. Just give us a call, because that's what we're here for. We also have a number of support groups across Canada, and we know they're very important for points of contacts, and they've had to cancel their face-to-face meetings. So what we've done is we've provided them with conferencing technology so they can go ahead and hold their support group meetings virtually. So I invite you to connect with them, and if you want to find out if there is a support group in your area, just go onto our website under support and you'll be able to find them. And we also have virtual support groups through Facebook, and you can join them again by looking through our website and looking at where you can find information. So if you're not already registered on our website, please, I invite you to go at Myeloma Canada. Sorry, I have my dog here. Can you imagine doing this in the evening? It's kind of, he's supposed to be really quiet, but he's not listening to me today. So if you want to receive our info bulletin, please register on myelomacanada.ca. And lastly, if you're worried about anything, please do give us a call. Go on our website. You can find our phone number, or you can find our contact information, and we'd be more than happy to help you. And meanwhile, please stay safe, stay home, and stay healthy. Thank you very much, and good evening.
May I make a final comment, Martine?
Absolutely.
Yes.
Yes. thank you tremendously, Dr. Durie and Dr. Mian, and all healthcare professionals in Canada or around the world for working so tirelessly through this crisis to look after us.
Thank you so much, David, and thank you again to you all for making this possible. And it's an honor for me to inform and help as much as I can. So thanks. And as Martine said, stay safe, and we are resilient with you all.
Thank you.
Thank you so much again for the
Thank you.
opportunity, and stay safe, everybody.
Thank you, and good night.